In podcast episode number 47, I talked to Chad Cook about the demonization of and the future of manual therapy. Chad is a physiotherapist, clinical researcher and lecturer at Duke University and has recently published a paper on the demonization of manual therapy, where he evaluates common critiques on manual therapy. It's important to notice that Chad's definition of manual therapy is a passive external force to the body with therapeutic intent, which includes manipulations, mobilizations, and soft tissue mobilizations, and it excludes acupuncture and needling. When asked why there is so much criticism on manual therapy, Chad said that it's probably due to 4 reasons. Outlandish and dated philosophical constructs around manual therapy, and elitism and guruism, and critique might mainly come from a group of clinicians who predominantly see patients in chronic pain where manual therapy is just not the best approach, and critique on manual therapy seems to be a social media phenomenon that helped some social media influencer to elevate their positions. He further explained that manual therapy is a different pain modulator than ice packs, going for a walk or exercise, in that it leads to physiological changes in the body. Another reason that manual therapy might be such an effective pain modulator might be due to the contextual benefits of patients actively pursuing care, which is different than telling someone to just put an ice pack on or going for a walk. Personally, he has abandoned segmental motion assessment on hypomobility in the lumbar and thoracic spine due to their low reliability and validity, but still sees some value in the cervical spine where pain-related movement can be assessed. Based on the literature of Nim et al. In 2022 and a 2016 study that he was involved in himself, he doesn't believe that a specific manual therapy approach is necessary or superior to a non-specific approach when it comes to treating a painful body area. There's also not a single paper showing a superior effect of a specific approach in comparison with a non-specific approach, and even 2 papers showing that a non-specific approach might be superior. So how do we select patients that might benefit from manual therapy? For Chad, these are patients with predominantly nociceptive pain. Another indicator can be if actively or passively moving the painful segment or body part seems to modulate pain. He has also conducted research himself where they found that a 30% pain reduction after PA mobilizations were a prognostic factor for a favorable outcome in patients with neck and low back pain. A third factor is patient expectation. If a person expects to see benefit with a manual therapy approach, this is a strong predictor of a positive outcome. And at last, earlier positive experiences with manual therapy might elevate patient expectations as well. According to Chad, the way that manual therapy is taught needs to change. The idea that you need 10 courses to achieve ability is probably based on the pioneers in manual therapy that put their ideas forth in educational courses. While it's not necessary to follow extensive courses, we both agreed on the fact that students need to learn handling skills in order to be able to safely mobilize and manipulate. Apart from the techniques themselves, education should focus more on communication with the patient as well as on recognizing favorable outcomes. The literature that compares manual therapy to sham interventions is so low in quality that we cannot say we currently have a true comparison between manual therapy and sham interventions. 46% of studies included in the review of Lavazza and colleagues in 2021 involved only one technique performed one time, and we cannot expect any real effect from just one intervention. We also talked about the fact that contextual factors like the relationship between a clinician and a patient, the environment, the therapist's thoughts and beliefs, and patient expectations are probably the reason why some practitioners see more success than others, and that embracing those contextual factors is not only important in manual therapy, but other interventions as well. One of the biggest critiques on manual therapy is that it creates patient dependence and reliance. However, there is no literature to back up this claim at all. To Chad, This critique comes from the fact that this message is repeated over and over again in social media until it was taken for effect. On top of that, many of us have experienced situations with a patient that has 100 visits with a healthcare professional applying passive techniques over and over again without success. To him, that's more of a management issue. At last, it can also have to do with patients with a passive coping mechanism who are more likely to pursue passive care, which is very hard to change. In general, Chad believes that manual therapy is probably most effective if used early during the first couple of visits, and it should always be combined with other interventions. Yet, there are certainly patients in which reducing pain is not a great objective and where we should rather focus on disability as an outcome and where manual therapy is not a suitable intervention. When looking at cost effectiveness, the literature is clear that manual therapy is as effective as active interventions and more cost effective than usual care. Furthermore, one study showed that patient satisfaction is lower in exclusively active-based interventions compared to passive care. All in all, the claim that manual therapy does not fit into value-based care is unsubstantiated. The best approach in terms of treatment outcomes, based on a review of Lutz in 2022, is to be flexible and to adjust your treatment process. This means that you are able to tailor your approach toward the patient in front of you and also change it during the process. At the moment, the pendulum is swinging in a direction that a lot of young physios completely abandon a hands-on approach. However, the literature is surprisingly mixed and exercise does not seem to be more effective than manual therapy, like a recent Cochrane review by Hayden et al. Found out. According to Chad, manual therapy will move more towards an evidence-based approach, and we will probably have a better understanding of where it fits an appropriate treatment approach. If it can divorce itself from outdated biomechanical theories and the elitism and guruism around it, and if we can gain a better understanding of the underlying mechanisms, manual therapy will have its place in value-based care. I hope this podcast summary got you interested in the full episode. Make sure to watch it here on YouTube or head over to physiotutors.com where you can also find bonus material.